Hi, my name is Marilyn Garcia, and I will be going over the implications of poor technological application. The first point I want to talk about is security. We have to be very careful with hacking and viruses with our computer systems. An example of this happened in 2018 when the CEO of Hancock Regional Hospital in Greenfield, Indiana, got hacked, and the criminals had obtained the login credentials of a vendor that provides hardware for one of the information systems used by the hospital. And that allowed the criminals to inject malware and encrypt the hospital's data. So that meant that they had access to patient information. Unfortunately, the CEO did have to pay the criminals, but now he spends his time educating about the importance of having good security for computer systems in hospitals. Another point I want to talk about is privacy and communication. So, one of the quotes I found in our book is that the 21st century possesses an additional challenge to nurses in communicating via technology. So, although technology has provided us many routes and sources of communication, it is still very difficult for nurses. One of these examples is the overuse of emails. So, for an email, the intent is to deliver information efficiently and rapidly to staff members. However, the emails may become too frequent, creating great volumes of unnecessary messages. And it becomes a problem because people start avoiding this type of communication, and emails can also be sent to the wrong people. And if the information is not sent correctly or received appropriately, the message is not communicated and the process is ineffective. A result of improper use of technology can also relate to HIPAA, which was created in 1996 and implemented in 2003. So originally, of course, this was like paper charting and other sorts of information that we had written on, but this transferred also over to the computer systems because as nurses, sometimes we have our electronic medical health record out, and somebody can give us a call, and now we have information on the computer that anybody could see. So it's just important to like minimize our screen or have some sort of lockout system so that way we could step away from our computers. Another point that I want to talk about is monitoring. There's something called fragmentation and decentralization that happens with technology. So, an example of this would be if a patient has multiple healthcare providers and one of them has access to an x ray that they took, and the other provider wants to see it. However, they don't have a like communication, so there's an interruption and delay in care because they don't have a method of communicating. Um, Another thing is alarm fatigue. So, alarm fatigue is described as a psychological phenomenon that occurs when a person is repeatedly exposed to an alarm or alert noises and subsequently becomes desensitized to them. And alarm fatigue has become a very serious issue. It has been named the number one technology hazard by Emergency Care Research Institute for 4 straight years. The Joint Commission has reported receiving 98 alarm related reports, of which 80 led to fatalities between June 2009 and June 2012. Another example of this, which attracted a lot of national attention, was in 2010. A patient at Massachusetts General Hospital has lost their life, and their death had been attributed to a heart monitor alarm being turned off the night before. So, what happened was that, or what usually happens is that we use technology to help us, and it's advanced so much that it helps us care for patients. But, when these alarms are going off and we're consistently hearing them, it becomes an issue. So, for this patient, the nurses did not notice that the alarm had been turned off, and there was no auditory indication that the patient was declining. Um, Eventually, their heart stopped, and the investigators found that nurses being consistently exposed to numerous alarms had been a part of the reason why they had led to the death. Um, so unfortunately, this is just one case where alarm fatigue has led to a fatality, but there's many other near misses that may have happened or are happening because of alarm fatigue. So these were just some implications of poor technological application.